Natural birth control methods. Avoid pregnancy with no pills or injections. Are you looking for a more natural birth control method without using any pills or injections at all? Well, you'll want to know what the options are, what's involved, and the drawbacks that you should consider first, including that they aren't sure ways to avoid getting pregnant. You also need to keep in mind that your partner will need to be on board, too. These methods won't work unless you're both committed and willing to follow every step on the way. Even then, however, the methods explained here still have a relatively high pregnancy rate. You might want to be more cautioned when using these methods. Let's go. Please subscribe down below to keep you updated on everyday health-related tips and best remedies here on Green Life Hub. 1. Fertility Awareness Method. What is it? These methods are based on your own body, no devices, no meds. They're free or low cost, safe, and effective when you use them the right way. But that's hard to do. The basic idea is to predict which days of the month you'd be most likely to get pregnant. You'll skip sex on those days. It sounds simple, but it's not always easy to pinpoint your fertile days. And if your period isn't regular, you might be better off with a different strategy. The odds of getting pregnant can be as high as 24% unless you use your fertility awareness method perfectly every time. 2. Rhythm Method. This strategy takes a lot of homework, and it's not simple. Because it can be confusing, avoiding pregnancy isn't a sure thing. First, you'll need to track your period for 6 to 12 months before you start. Then you can use that information and do some math to figure out when you're fertile. You'll use this formula. Subtract 18 from the number of days in your shortest cycle. Count that many days after you start your period. That's your first fertile day. Subtract 11 from the number of days in your longest cycle. Count that many days from the start of your period. That's your last fertile day. Don't have sex on or between your first and last fertile days. There are apps for this. But in order for this method to work, you have to be very good at tracking. That can be hard to do, because it's common for cycles to vary slightly. Medical conditions like thyroid disease, eating disorders, excessive weight loss or gain, strenuous exercise, and illicit drug use may cause your cycles to become irregular. 3. Standard Days Method, SDM. This is like the rhythm method, but it's simpler. It sets the same days 8 through 19, as the fertile time for everyone. That makes it easier to use. You can use an app, a calendar, or a color-coded set of beads to track where you are in your cycle. It works best if your cycle is more than 26 days or less than 32. 4. Cervical Mucus Method. This plan also involves checking the mucus from your cervix at certain points in your cycle. Just after your period, there's very little. When you're ovulating, there can be a lot. You can also notice changes in its texture or color throughout your cycle. All of these clues may help you know when you're ovulating. Cervical mucus on your fertile days can look clear, slippery, and stretchy, like egg whites. You can use a tissue or your fingers to check it several times a day. It's best to keep a chart so you can see the patterns in your cervical mucus from one cycle to another, and then know when you should skip sex. 5. Withdrawal Method. One way to avoid pregnancy is not to give sperm a chance to meet an egg. When you use this method, also called pulling out, the man pulls their penis out of their partner's vagina before they ejaculate. That takes a lot of self-control. Because that doesn't always happen, there's a 22% chance of getting pregnant if you use this tactic. 6. Breastfeeding. This approach works only for the first 6 months after giving birth, and only if you haven't gotten your period yet and you exclusively breastfeed your baby, no formula and no bottles at all. You'll have to nurse at least every 4 hours during the day and every 6 hours at night. Pumping doesn't count, this keeps your body from releasing an egg. 7. Basal Body Temperature Method. Another way to tell when you're fertile is to keep a daily chart of your temperature. You use a device called a basal body temperature thermometer at the same time every day. When you ovulate, your temperature may go up almost 1 degree Fahrenheit. It's also good to pay attention to other symptoms you might be having, like sore breasts, backaches, or bloating. But still, you can't know precisely when you ovulate by this method. Also, if you have an illness that causes fever, are stressed, drank alcoholic beverages the night before, have traveled to a different time zone, or have slept in a warmer or colder room than usual, all may affect your basal body temperature. That can also make this method harder to use. Please subscribe down below to keep you updated on everyday health-related tips and best remedies here on Green Life Hub.